Hey everyone, hope you're doing well. For those of you that don't know me or maybe new to my page, I'm Erin. I'm the nurse practitioner at HKB Cosmetic Surgery. And today I wanted to come on here and talk a little bit about some of the different uses for Botox that you may not know about. So Botox and Dysport, typically everyone knows them for treating the forehead, the glabella region right here, or the 11 lines, the forehead, and then around the eyes or the crow's feet. But there's actually several other areas that Botox and Dysport can be used that provide really beautiful results. So one of those I wanted to talk about today was the low face. So a lot of people have noticed that their neck or low face is starting to age. And I think, the neck area shows our age pretty rapidly, but it's one of those areas that we really forget about or neglect when it comes to our skincare. So first is the mentalis muscle or the chin. So you can start to get kind of this dimpling effect to your chin, and Botox can actually be placed here to smooth that out. Along with that is the DAO muscle, which is a depressor muscle that pulls the corners of the lips down. So Botox can actually be placed strategically here to help weaken that and give you a nice upturned lip. So if people that kind of always look angry or you feel like you always look sad, that's a really nice option for you there. And then additionally with the neck area is the platysmal muscle or the platysmal band. So as these muscles strengthen, we develop these bands that kind of go up and down. You can see here, I need to have mine done, but they're pretty strong, right? So we can actually place Botox along there to soften that and provide this nice mild tightness to our neck. Now with the chin, the DAO, and the platysmal bands, when those are done in conjunction with each other, they're called this Nefertiti lift. And so that's because it softens the low face here and then provides a little bit of tightening to the neck. Not good for someone who has a lot of excess collagen or elastin. It's just not going to provide the tightening that you want, and this does not replace a lower facelift or other treatments alternative to surgery like RF microneedling or CO2 laser, things that can actually tighten the skin. So moving on from there, the lip area is somewhere that people like to use Botox a lot. This lip flip has become very popular. So Botox can actually be placed along the border of the lip here. And what that does is as you smile and your lip curls under, it's actually going to curl it up. So you have more of a show of your lip and it gives the appearance of being larger without actually putting lip filler in there. So it's good for someone who just wants a little bit more show of their lip. Not great for someone who feels like they don't have much show of their teeth already, because this can drop your lip a little bit. And so if you already don't feel like you have a big smile, I wouldn't recommend it. To that point too, Botox can be placed a little bit higher up to drop the lip even further and treat people that have a gummy smile. So a lot of people don't like when their gums show when they smile, so that can be really helpful for there. And then lastly, well, actually two more things. One is the masseter injection. So this is great for someone that has TMJ or bruxism and grinds their teeth all the time to the point where they're getting really severe headaches. So Botox is placed in the belly of this muscle here to soften and weaken that muscle to prevent you from doing that repetitive motion of grinding your teeth. Works really, really great. I've had patients where completely changed their lives because they're no longer getting headaches and waking up with those headaches. So really helpful. And if you have a really boxy jaw that you don't like, I personally like a boxy jaw or a defined jaw. It'll give you a little bit more shaping because it's going to slim that hypertrophied or that muscle that got really large from all the work it's been doing grinding your teeth. It's going to soften that to give you more of a slimmer appearance. And then lastly, Botox can be placed in the underarms for hyperhidrosis or excessive sweating. So it's placed strategically, several and multiple injections along the line, the rim of the underarm, but what it does is it blocks that signal to produce that sweat gland. For that sweat gland to produce sweat. So it works really great for someone who this is, a really significant problem for them. It does take quite a bit of units, around 50 per side. So it's around $1,200 probably. It's quite expensive, but it works and it can last up to 4 months for most people. So I hope that helps. Those are, a bunch of alternative uses you may not know of for Botox. If you have any questions, please comment below, and we hope to see you soon. Stay safe.